It's extremely useful and important to gather the user feedback throughout the design process because it helps tailor make a product for someone, and when you tailor make the product for the user, makes the product feel a bit more personalised for them.
So basically it's important when you're trying to solve a real life problem that you're able to understand and empathise with the users, so you can base your design work and your thinking on real life experiences.
Once we've got the feedback, we can use it to adjust our designs. So through iterations and so on, we would develop the design to make it more personal for the users.
So we use methods and tools such as focus groups, interviews and shadowing in order to build user personas that allow us to basically create how might we statements that allow us to answer the important questions on a project.
Well, we actually use our co-founders quite a lot for this, and they help gather a panel of experts in the field. And with all their knowledge, it really helps give a real expert's opinion to help us design our work.
As part of the Nova process, we expect our co-founders to build a user panel that we're able to use to test our prototypes and our concept work. But it's not only for product design, it'll also be used for our UX work and also service design.
At Nova, we're really lucky that we have an office in Centre City, and they have their lab spaces downstairs, which we have full access to. They've got various 3D printers, laser cutters, CNC milling machines, and essentially you can create anything that you need downstairs.
They literally have state-of-the-art equipment, 3D printing to the highest standard, and they have, for the electronic engineers, they have tools that can surface mount components on curved surfaces, and they have really useful tools for us.
Well, you have to think about who you're designing the product for. So you're designing it always for a user, and the product could be for someone maybe who's elderly and so on. So once you're designing a product to be for the elderly, you always have to consider that the parts will need to not be very fiddly. They've got to be quite easy to handle. So there's lots of challenges facing where you've got to think about the user specifically.
Some of the biggest challenges we face are being able to speak to the correct medical professionals that their projects are based in, but fortunately for us, our co-founders are either usually in the field of the project, or they've got a background in the field, or they are connected or have a good network of people that are in that field. And also our researchers in the engineering team also have a really good network of university professionals who are also based in healthcare. So it allows us to branch out into the university as well and hopefully get in contact with the right people for the project. So when testing products and design work, we use our user panel, and we basically look for the prototype or product to be intuitive to use and simple. And if they have a good understanding of the product whilst they're using it without us explaining what it is, what it does, it served its purpose.
For the healthcare industry, it's really fantastic that we're always helping people. It's really great to see that we're designing products that can actually make a difference to someone's life. And also it's fantastic to see your own creation go from sort of your computer screen to actually being a made real product.
So I enjoy the whole design process, to be honest, from empathising and understanding the users to creating concepts that visually provide how the product is used and also how it fits into the service. And again, building prototypes and testing with users is a lot of fun as well. So I think there will be more of a harmonisation of the infrastructure of healthcare, not only in the UK, but around the world. And I also think that through technology, there will be a personalisation of the individual's data through the use of sensor technology and also the processing of biometric data.
Well, I think it's always really good looking back 10 years to see how far advanced we will be in the next 10 years. So to speak, 10 years ago, we didn't really even have iPhones. We didn't even have 3D printers as accessible as now. So technology is going to really advance quite far. If you go to hospitals now and care homes, they're using app-based technology to help keep their staff running day to day, and they help keep the patients informed day to day through these apps, which wasn't available 10 years ago. So if you look for the next 10 years, you can really see that technology is going to advance very far. Not too sure where it's going to go, but it will definitely go a lot further.